Some of the primary care issues that we deal with in our community revolve around having a significantly larger than average population of senior citizens with significant complex care and complex medicine comorbidities, which is a challenge in many ways, but also an exciting opportunity for us to practice complex medicine in a semi-rural environment.
GP4Me has been working with the Vulnerable Patient Hotline, which is a program that attaches vulnerable patients, so those who suffer from mental health, addiction, as well as being homeless. So the project has really worked out great. We've attached a lot of patients and now they're actually seeing physicians on a regular basis. Well, with the GP4Me, we've been able to help support physicians with a nurse clinician team, as well as holding multiple CME sessions that help educate physicians on billing, as well as helping on local healthcare issues. Well, so far we've had success in the program by really galvanizing the community and working together. In fact, we formed groups with the local mayors from Parksville, Qualicum, as well as our MLA. And we've really worked together hard to recruit physicians and support the ones already working in our community. The GP4Me project has really helped strengthen the Oceanside community. We're working well with our stakeholders as well as Island Health. And it's really helped galvanize the local physicians on helping improve patient care.
So going into the next 3 to 5 years, our priorities for our community really revolve around recruitment and retention. We need a significant amount of recruitment into our community to replace aging physicians, and we need significant support for our remaining physicians to ensure retention. We also need to continue our work with palliative care, creating comprehensive teams to support frail elderly patients, which is a big component of our practice. And we need to continue to look at innovative ways to support our aging population, as well as supporting our physicians in supporting that population. For me, the most inspiring part of my work with GP4Me and our community has been the cohesiveness that we've managed to achieve in our community. Before GP4Me started, there were a lot of stakeholders, community advocacy groups, hospice, health and wellness networks that were trying to achieve things for the community in an independent fashion. And through the GP4Me, we created the ability to have those discussions in a more broad perspective and bring all the stakeholders together to say, let's work on common goals, let's be strategic about how we achieve things in the future. And that will transcend beyond GP4Me, because once GP4Me ends, those relationships will have been cemented, and we will use that to be more successful in our future endeavors.